or-luh-DAY-oh is the treatment that I've been looking for since I was diagnosed with HAE 10 years ago.
It makes life easier. And as a caregiver, I don't worry as much anymore.
Or-luh-DAY-oh means freedom. Freedom to travel, freedom to do whatever it is that I choose to do. After many years with many different therapies, I finally have that freedom.
It's been a blessing to have that ease and simplicity in our life.
I was well controlled on HAE with an injectable, but the thought of being able to take a pill and not have to do that anymore was huge for me. I was concerned though that, I may start having swells again. And then within 2 months, I was off of the injectable and well controlled.
It's not only just the convenience, but it actually works for me. I've noticed the longer that I'm on it, the less frequent my attacks.
Well, and for my daughter Leia, it works every day, and it's simple, it's a pill. I don't have to think about it. My daughter doesn't have to think about her diagnosis. She loves her or-luh-DAY-oh, and she may not remember to take anything else, but she takes that every day.
The side effects I had with or-luh-DAY-oh were predominantly GI. Really, I just used over-the-counter treatments, and that took care of the problems, and the problems actually resolved over time.
One experience for me was our first flight. It was nice just not to have to worry, just put the medicine and go.
or-luh-DAY-oh has simplified my life.
It alleviates a lot of stress. It's been really great seeing you all today, getting to know each other better.
I have thoroughly enjoyed today.
Yeah, it was really great just getting to know each other a little bit better.
And we have a lot of different experiences with HAE, but we have one thing in common, and that's or-luh-DAY-oh.
What is or-luh-DAY-oh? Berotralstat. Or-luh-DAY-oh is a prescription medicine used to prevent attacks of hereditary angioedema, or HAE, in adults and children 2 years of age and older. It is not known if or-luh-DAY-oh is safe and effective in children under 2 years of age. It is not known if or-luh-DAY-oh is safe and effective to treat an acute HAE attack. Therefore, or-luh-DAY-oh should not be used to treat an acute HAE attack. Do not take more than 1 dose of or-luh-DAY-oh per day because extra doses can cause heart rhythm problems. Important safety information. Before taking or-luh-DAY-oh, tell your healthcare provider about all of your medical conditions, including if you have liver problems or kidney problems, are pregnant or planning to become pregnant. It is not known if or-luh-DAY-oh can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if or-luh-DAY-oh passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while taking or-luh-DAY-oh. Tell your healthcare provider about all of the medicines you take, including other medicines for HAE, prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking or-luh-DAY-oh with certain other medicines may affect the way other medicines work, and other medicines may affect how or-luh-DAY-oh works. Know the medicines you take and keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. What are the possible side effects of or-luh-DAY-oh? Taking more than 1 dose of or-luh-DAY-oh per day may cause serious side effects, including heart rhythm problems. A heart rhythm problem called QTc interval prolongation can happen in people who take more than 1 dose of or-luh-DAY-oh per day. This condition can cause an abnormal heartbeat. Do not take more than 1 dose of or-luh-DAY-oh per day. The most common side effects of or-luh-DAY-oh include abdominal pain, vomiting, diarrhea, back pain, and heartburn. These are not all of the possible side effects of or-luh-DAY-oh. For more information, ask your healthcare provider or pharmacist. Talk to your healthcare provider for medical advice about side effects. You are encouraged to report side effects of prescription drugs to BioCryst Pharmaceuticals Incorporated at 1-833-633-2279 or to the FDA at www.fda.gov/MedWatch or 1-800-FDA-1088. For more information, please see the full prescribing information, including the patient information.